acid reflux, GERD for short, gastroesophageal reflux disease. Anybody seen Alka-Seltzer lately? There's like 25 different kinds of Alka-Seltzer.
I remember the old one, but that's only, I never could handle that.
Plop, fizz, oh, what a relief it is. But it's for all sorts of different stuff now. So anyway, I've got a picture up there, but so this, you can see the blue at the bottom on this guy's shirt, that's the intestines, and then the stomach is that pink curved part with the bubbles in it, and then the esophagus is the part going up to the mouth. Chronic disease occurs when the stomach contents flow back up or reflux into the esophagus, so things kind of go backwards. Pretty much everybody has experienced reflux at some point or another. So I assume everybody here has belched or burped at some point, right? That is gastroesophageal reflux. So stuff coming out of the stomach going backwards. So normally when we swallow, it's a fairly coordinated process to keep it from going down the lungs, but the epiglottis in the back of the tongue kind of flips down, covers the airway. Food goes down the back, down the esophagus, and it's a muscular tube that kind of milks the food down into the stomach. And then once in the stomach, there is a lot of acid in there, and that's when our digestion starts once we put food in our mouth, because we have enzymes to break it down, but it really gets going when it gets to the stomach. So the acid starts to break down the food, and the stomach is protected from the acid by a mucus lining that it makes that's very specialized. So can you swallow if you're upside down? Anybody ever tried that? Hanging upside down, try to drink a Coca-Cola?
I never have.
You can actually do it. There's some people in old trick shows and stuff, they'll hang upside down and can drink the Coke. The esophagus will actually get the food to the stomach if you're upside down. A lot easier to choke, we think, but it can be done. So the esophagus actually does quite a bit of work. Anyway, so GERD in particular is an underappreciated disease. It actually causes a lot of trouble. It's not just heartburn. 25% of the population are bothered by it in some way or another, and it can have significant morbidity, increased risk for some cancers, asthma, lots of stuff. We'll go through some of that in a minute. And then the treatments for it are some of the most commonly prescribed medications in America, probably in the world. But omeprazole, which is Prilosec is the brand, that's the 10th most common prescribed medicine in the U.S. So there's a bunch of them. So there's Prilosec, Nexium, Protonix, Prevacid, Dexilant. I think there's a couple more. So there's several different medicines that all work pretty good, and omeprazole is number 10 of all medicines in the country. So there's a lot of those prescribed. So what is the problem with acid reflux? We have to have acid in our stomach to help us start digestion, to break down food, because we eat a lot of different things. I've actually heard stories about, there was a guy several years ago that ate an airplane. He broke it down into tiny metal pieces. He did something to get his acid up, but he actually, over a period of time, was able to digest an airplane. I wouldn't recommend it, but anyway. So the pH of water, so y'all may not know what the pH scale is. So that's how acidic or basic something is. So it goes from 1 to 14. So water is 7. Water is neutral, not acidic or basic. It's right in the middle. And the pH in the stomach is 1 to 2. So and anybody know what the acid in the stomach is? We secrete hydrogen ions. It's hydrochloric acid. So we have hydrochloric acid in our stomach. So it's pretty caustic stuff. And then the esophagus is pretty neutral, but a pH of less than 4 can damage it. So when that acid comes back up, it doesn't take much to do some damage to the esophagus and the back of the throat, things like that. It would not be a good idea to drink hydrochloric acid. That would be bad. So what we think of typically with acid reflux is the burning sensation in the chest. You get a burning that goes up toward your throat, and then the perception of stomach acid in the back of the throat, especially if you lay down after you eat, things like that. We probably all had something like that. You'll get a little of that odd nasty tasting stuff in the back of the throat. But there's a whole lot more to it. It can cause all sorts of different symptoms. So not just heartburn, but it actually can make you have difficulty swallowing. So if it irritates the back of the throat, that complex process of getting the food down in the proper way can be disrupted. And then Barrett's esophagus. I don't know if you know about Barrett's esophagus, but that is actually where over time you have enough acid reflux that the esophagus it's getting damaged. It tries to change. It's a squamous cell in the esophagus, and you have columnar epithelium in the stomach. They're a lot thicker and taller, and they make all that mucus. The lining of the esophagus is more like skin cells, real flat squamous cell, more fragile. When the esophagus starts to get exposed to all that acid, it tries to change and become columnar epithelium. It tries to change. Well, as you might imagine, when your cells in your body start trying to change and become something different, that is not good because it's not meant to do that. And a lot of times it can develop into a cancer type cell. Anytime a cell is trying to change the way it's doing, one of those millions of cells can become cancerous and then overgrow. So Barrett's esophagus is exactly that, where usually the lower part of the esophagus where the acid first hits starts to change. You can see that on a scope. I've got some pictures I'll show you in a minute. So Barrett's esophagus is one, and then what it turns into, what you worry about is adenocarcinoma, esophageal adenocarcinoma, which is cancer, and that is not good. Cancer, there's a few types of cancer that you really don't want. Pancreatic cancer is bad, ovarian cancer is bad, and esophageal cancer is bad. Getting it out of there is rough. The surgery is rough. It's hard to get to it. Those types, and it's just not good. You usually don't survive very long after having those kind of cancers. So, and then when it hits the esophagus, it can also cause chest pain. You probably have heard a story about somebody going to the emergency room for chest pain, thinking they're having a heart attack. They're having the big one, and then they get told it was just chest pain, which is good news. But you sat for 4 hours in the emergency room trying to figure that out, right? So. Anyway, so then the symptoms, if that acid gets up into the back of the throat, the airway, it can cause several other problems. So you have a sore throat. Some people have problems with sore throat. And, it's not strep, it's not bacterial infection, it's not a virus. It's just acid reflux irritating the back of the throat. It can cause a hoarse voice. A lot of times, I'll send patients they'll be hoarse. We've tried all these different things. They'll be hoarse for several months. Finally, I'll send them to ear, nose, and throat, and they'll do a scope, and they'll see their vocal cords, and they're red and irritated, and it looks it's acid reflux that caused that. Usually, but it can be other things. That's why you want to get a scope. So, globus sensation, that is the medical term for feeling like there's something in your throat, like a mass in the throat, something stuck in your throat. You want to swallow all the time. That's that feeling like something's in your throat. It can cause that. That constant want to clear your throat. That can be a problem. It actually can cause you to have more ear infections. Otitis media is an ear infection, and then sinusitis would be the sinuses. Can cause a sinus infection. So it can make you have more trouble with that. Dental erosions, cavities. So it can cause the teeth, especially the back, the molars. A lot of people with bad reflux, they'll lose a lot of teeth in the back. They'll just decay from the acid. And then laryngeal cancer. So same process. Basically, irritation of the throat. Things start to change, and you can develop cancer in the larynx, which is in the upper airway vocal cord area. So then you can have lung problems that can come up, and then a little bit of the acid can go down in the lungs. It actually can go into the first part of it is the trachea. And then you get the bronchial tubes as it divides, and then you got the much smaller parts of the lung, the alveoli, as it goes out. But a lot of people with asthma have acid reflux that causes a fair bit of that. So something to think about there, because it comes up, and the airway is so much more sensitive even than the esophagus to that acid. And so it'll cause a spasm, and that's what an asthma attack is when the airway kind of constricts all at once, and you feel like you can't breathe. So a lot of patients with asthma, sometimes you need to look at acid reflux. aspiration pneumonia. So if it gets up and then goes down into the lungs, that's called aspiration. If something that was from the stomach or something you swallowed went down in the lungs, we call that aspiration. And that's not good. You're only supposed to get air down in your lungs. So when that gets down there, if it causes an infection, that will be aspiration pneumonia. And that is difficult to treat because it's a little different bacteria. Typically, the bacteria from the throat and the stomach are different, or from the throat and the esophagus are different than the bacteria that usually cause pneumonia, like community-acquired pneumonia. Bronchiectasis, that's a chronic irritation and dilation of the bronchial tubes, and that people can cough up blood. You can have little streaks of blood when you cough, things like that, and then even pulmonary fibrosis. But that would be a pretty severe case. But that's where the lungs scar, and you have trouble taking a breath and getting oxygen across. So then there's just various other problems. So just upset stomach, symptoms of nausea, vomiting, abdominal pain. It can affect your appetite. You can not want to eat because typically it makes it worse. So you avoid food and you start losing weight. It can cause anemia and fatigue. Some other problems. So how do we, as physicians, what are we looking for when we diagnose somebody with acid reflux or GERD? So mainly symptoms. There's no great test. Like I went through all those symptoms. It's pretty easy to put the picture together if that's what you got. You have to just be aware of it and look for it. If you don't think about it, you won't make the diagnosis. So a lot of times it's so common, the patients come in and they tell me what they got. And then we try to make sure it's nothing serious. But anyway, there are some tests. So you can get an EGD. That's an esophageal gastroduodenoscopy. And that's why we call it EGD for short. So that's a scope of the stomach where you go to a gastroenterologist or surgeon, and they'll kind of make you sleepy, and they'll put a scope down with a light and a camera, and they'll look at the airway, the vocal cords, and the esophagus as they go down, and then they'll look all in through the stomach, and then they'll look. Sometimes they'll go just a little bit further into the first part of the small intestine. They can see that, and you can find ulcers, irritation. They can do biopsies. So like for bacteria H. pylori, which I'll talk about in a minute, they can take little pieces of the tissue with the scope and send that in and see if you got cancer, things like that. So they can do a biopsy with a scope. They can do a barium swallow. And that doesn't really help with GERD, but it can look at how everything works when you swallow, if something is not working right like it's supposed to. So a barium swallow, it's just that. They give you a liquid that's got barium in it, and that shows up on an x-ray. And so they do a video x-ray, and while you swallow that, they watch it go down and they can see it. So that's pretty straightforward. And they've got pH monitors. So we can take they don't do this very often now, but you can take a little probe, you swallow it, it sits down in the bottom of the esophagus, and you leave it there for a day or so, and it measures the pH the whole time. So if the pH in the esophagus is really low, that proves that you've got acid coming up in the esophagus. It's not a comfortable test. And then manometry, that's where they measure the pressure. So I mentioned earlier that you could actually hang upside down and swallow, and the esophagus would carry it up. So the esophagus generates a certain amount of pressure. They can actually put something down and measure that, see how well it squeezes, and tell if there's something wrong with that. Because if the esophagus doesn't squeeze, then that'll make you more likely to have stuff go the wrong way. And then just what ends up happening 90% of the time probably is, sounds like you got acid reflux, we'll give you this medicine, and if that knocks it out, that's probably what you had. But, you got the symptoms, we give you Prilosec, and you get 100% better. That's a pretty good test. And then also just something else to think about. I'm always kind of trying to get patients to listen to their body, and it's trying to tell you something. And many times, if you've got a lot of acid reflux, it may be something your body's saying, you need to eat a little less frequently, eat something different. Your body may be sending a signal saying, you need to change what you're doing. This is not good. So just a thought. So these, and I know these are not great pictures. I apologize, but I have to deal with top left is kind of a normal, so that's down at the bottom of the esophagus where it's about to go into the stomach, and you can see it's squeezed pretty tight right there. So the esophagus comes down, and the diaphragm, the muscle that we use to breathe, that moves the lungs up and down. When the esophagus goes through it, that muscle squeezes it and makes a little tight spot there in it. And so that, most of the time, keeps stuff from going back up the wrong way. And so that's a normal in the top left. And then the one right below that on the left, in the center on the left, is just one that's wide open. You lost all the tone. And then you can't really tell the bottom left, but that's a hiatal hernia. That's where the very top part of the stomach, right after it goes through the diaphragm, that top part of the stomach is called the hiatus of the stomach. And when that part comes up through the diaphragm, that's a hernia, because it's not where it's pushed up through that hole where it's not supposed to be, and that allows more acid reflux. And that's why if you have a hiatal hernia, you a lot of times have acid reflux. Then it starts getting graded as to how bad it is. So in the center on the top is grade 1. You can still see the tight junction, but it's a little more open. And then the middle, the very center picture is grade 2. Grade 3 is pretty rough. It goes on. And then here is Barrett's. I don't know if you can see, but there's these clear lines where it's different in the esophagus. It should all be the same, nice and pink. And again, I hope you can see some of that there. So then the warning signs, these would be bad things we don't want to see that might mean it's something different other than just a plain old acid reflux. So bleeding, if you're coughing up blood or vomiting blood, that is not acid reflux. If you're not eating at all, if it's really bad, hurt terribly when you eat, that's a sign it's something more serious than just acid reflux. Unexplained significant weight loss, so more than 10 pounds in a short period of time would be significant. That's not a good sign. And then, as you probably know, a lot of people with acid reflux, and many of them are overweight, so it usually doesn't make you lose weight. It can. Vomiting, repeatedly, that's not acid reflux typically. And you always worry about it if somebody's got bad symptoms and they've got a family history of stomach cancer or GI cancer. You'd want to work them up a little bit more detail than just somebody that nobody else had any trouble with cancer in their GI tract. So talk about some causes. And what causes it? So anything that weakens or loosens the esophageal sphincter, that's the tight part down at the esophagus where it goes through the diaphragm and then starts the stomach. So anything that loosens that up, so certain foods can do it. And most people with acid reflux will tell you they have to avoid a few things. So the food on the left is a little more irritating than the food on the right. And you'll see these things come up all the time. So fat food, soft drinks, things like that. Chocolate and coffee, probably more so because they have caffeine in them. The caffeine is a stimulant, so it'll make you have more acid reflux. Wine, I don't think wine does it too bad. It's probably drink too much wine would cause some trouble. And then onions and garlic, spicy food, tomatoes, dairy, can be a little rough for some people. And then the good stuff is always good. So leafy green vegetables, ginger, celery, berries. I've rarely had to tell anybody to stop eating celery. It just doesn't come up very often. And then apples, avocado, things like that. So I haven't had a patient come in ever and say, "Doc, I can't stop eating these green beans." So anyway. So other things that can do it, smoking, tobacco is, the nicotine is terribly acid reflux causing. It really irritates the stomach and causes a lot of reflux. So try to get people to quit smoking. Alcohol, it's like anything else. A little bit's not too bad. If you overdo it, you're going to have a lot of trouble from it. Pregnancy, anybody who's been pregnant can tell you their acid reflux is probably a lot worse, especially later in the pregnancy, just from increased pressure in the abdomen. A lot of medications can cause it. And then not just pregnancy, but just being bigger, more pressure is going to push things back up. And then a hiatal hernia, which I talked about, will make you have more acid reflux. And then H. pylori, this is actually a bacteria that can live in the stomach acid. We thought, probably 30 years ago, we thought there's no bacteria that can live in the stomach. It's way too acidic. It's nothing can live there. But this booger can do it, and it causes trouble. So it'll get in there and causes ulcers, things like that. Although a lot of people have it and don't have any trouble with it. So if we biopsied everybody, there'd be a lot of people that had it that don't have trouble. So it doesn't always cause trouble, but it certainly can. And when they do a scope, they'll take a biopsy and do a test for it. There is one way to check, and then there's breath tests where you take it, you eat this one thing, and then you do a breath test and it picks that up. It reacts with H. pylori, something it makes, and it absorbs into the body, and then you breathe out and you can pick that up. And then you can actually do a stool sample and pick up H. pylori antigen and see if you got it there too. The scope is probably the most common way to find it. And then if you get it, it's very hard to kill. So you have to take a couple of antibiotics. You got to take a strong proton pump inhibitor, things like that. There's several things you got to take, at least 3 medicines to take to kill it. And you got to take it for a couple of weeks. So, any questions on that? Of the Last Supper, people eating, getting acid reflux, and it was Easter. So you got acid reflux. Now what? Well, first thing, a good doctor is probably going to tell you to change what you eat, to look at some of those foods and they're bad and decrease them. Try not to eat so much. Don't eat late and then lay down. So gravity helps us while we're standing up. We eat a big meal and we lay flat and everything goes backwards, right? So that's another thing. You can also kind of cheating a little bit, but you can put a brick under the head of the bed, the feet of the bed, to raise the bed just a little bit, a couple inches can make a big difference. Extra pillows, things like that. I just try to eat less or not right before bed, but anyway, they're cheap. They don't have any side effects. Those things usually work pretty good. You can take acid buffers, so the pH of 1 or 2 is very irritating. You can take these things that are basic, and they balance that out. So, Tums. Anybody know the chemical formula for Tums? Calcium carbonate, I think is what it is. So calcium carbonate is a base. So it's classic acid-base reaction, which is not equal, but if you take something of pH of 3 in the same amount, and you put it with a pH of, that'd be 11, they would, in theory, get you to about a 7, equal out. So try to balance that, get it closer to 7 where it doesn't irritate. Because if it's 7, it doesn't matter if you have acid reflux, it's not going to irritate anything too bad. It's not, if it gets in the airway, it will be bad, but the esophagus is going to be okay. So we take Tums, Mylanta, Maalox, Rolaids, Gaviscon, things like that to kind of ease the acid. And then there are H2 blockers, so that's histamine. It's a histamine 2 receptor. There's lots of histamine receptors. Histamine 1 is going to be more allergy stuff, so like Benadryl. Benadryl is non-specific. It gets a lot of different histamine receptors, so it helps with allergies. But there's one specifically for H2, and that's going to be, right now, Tagamet and Pepcid, or cimetidine and famotidine. You've probably heard of those. They're over the counter. You can take those. They cause the stomach to make a little less acid, and they're effective usually for mild to moderate symptoms. But the king is the proton pump inhibitor. So that blocks the proton pump that pumps the hydrogen ion of acid into the stomach. And they are very powerful. And so they really raise the pH of the stomach and can actually help make it more difficult to digest some food. So because that powerful change, it can affect your gut health. So it affects a lot of stuff downstream. So if you take proton pump inhibitors for a long time, it can cause lots of irritable bowel symptoms, things like that, which I'll talk about proton pump inhibitors a little more in a minute. But more names and the doses. So esomeprazole, that's Nexium, the top 20 to 40 milligrams once a day. And you're not supposed to take them more than 4 to 8 weeks, typically. A lot of people stay on them longer than that. But, lansoprazole, I think that's Prevacid, Protonics, I get them mixed up. Omeprazole, that's Prilosec. Pantoprazole is Protonics, so lansoprazole is Prevacid. Anyway, doses. You can see 4 to 8 weeks, that's the kind of FDA recommended duration to take them. You probably know a lot of people take them a lot longer than that. So here are some concerns, and the evidence on some of these is mixed. It's a little controversial, but there's been some concern about osteoporosis. It's speeding up osteoporosis, especially in women, because if the stomach is less acidic, we may not absorb calcium quite as well. And if we don't absorb calcium, then we can't put it in the bone. And if we don't absorb calcium, our calcium level drops. We will release calcium from the bone to keep our calcium level normal, and that would speed up osteoporosis. So that would be a way that could happen. But it's a very complicated process. It affects magnesium and phosphorus and all that sort of stuff. So it's not that simple. And then it's been associated with an increased risk of C. diff. I don't know if you've heard of anybody in the hospital with C. diff colitis, but that is really bad. And it's getting very resistant to a lot of the antibiotics we have to treat it. So C. diff can be a big problem. And I wouldn't want to take anything that would increase my chance for that. So that a lot of times caused by antibiotics. So you take antibiotics and they kill off most of the healthy bacteria in your gut, and C. diff is not killed, and it takes over and causes all sorts of ruckus. And proton pump inhibitors, it looks like, might increase that a little bit. And malabsorption, so I think there's several studies that show you don't absorb certain vitamins and minerals as well when you take proton pump inhibitors for the same reason we talked about. Iron is pretty hard to absorb. I don't know if you've ever had to take iron pills, but nobody likes taking iron. B12 is pretty complex absorption as well. B12 is actually we make a thing called intrinsic factor. It's a protein in the stomach. B12 has to bind to that, and then down at the end of the small intestine, which is pretty good ways down, that's where it's absorbed. So it takes quite a bit to get B12. And that's why you see a little bit of B12 deficiency. You've probably heard people getting B12 shots, things like that. So if you don't absorb it from the GI tract, then you get a shot and get it and bypass the stomach. That's why people take B12 shots. And low B12 can cause all kinds of nerve problems and things like that. Dementia, there's actually increased risk of dementia with proton pump inhibitors, so pretty good reason to try not to take them too long. Pneumonia, you still have the acid reflux, but it's not as acidic, and so you can have more trouble with things getting in the airway possibly and not realizing it. So it's one of those things like pain is a good thing. When we get hurt, it makes us stop what we're doing. Well, you got acid reflux and you realize it, you're going to stop what you're doing. If you're on a proton pump inhibitor, you keep overeating, you have acid reflux, you don't really notice it, you get some of that aspirated, you get some pneumonia, you have more trouble from it. Just a thought that's pretty, not real common, but increased chance of it. I'm not sure what the mechanism would be for kidney disease, but there are some studies that show a possible link between that and between proton pump inhibitors long-term and kidney problems, and then stroke for some reason. And there's some references at the end that I show about that. Small risk, but significant. And then the biggest problem with them is they can be really hard to get off of. So think about the proton pump inhibitor like a dam holding back all this acid. So the acid's being made in the cells, and it's ready to go. It's ready to get dumped into the stomach, and you've put on the brakes and held it right there at the last step. And so like this dam. Well, if you stop taking your Prilosec just all at once, well, the floodgates open up, and you have the worst acid reflux you ever had in your life. And so what do? I got to go back on that Prilosec was really doing a lot of work. I got to get back on my my acid reflux medicine. So you've got to wean off really slowly to keep that from happening, or you'll have really bad acid reflux. So they can be quite hard to get off of. It can take months to get off of them if you take them for a long time. So a lot of patients they don't want to take proton pump inhibitors, but they have acid reflux, so they ask me what can they take, and there's actually several things. Licorice is really good for acid reflux, and a few other things too. Ancient Chinese remedy, but it needs to be deglycerinated. There's a glycerin molecule on there that you want to get rid of, because if it's not, it can raise your blood pressure. So plain licorice, if you got a lot of my patients that have acid reflux also have high blood pressure, and so deglycerinated licorice, and that's what the DGL on this bottle stands for, deglycerinated licorice. So you can take that, and that can help. And if you're on a proton pump inhibitor and trying to get off of it, you could try and wean down the dose of the proton pump inhibitor and take some DGL or some of these others and kind of meet in the middle. Slippery elm bark is a good supplement for acid reflux. Marshmallow root can help a little bit. Aloe is actually pretty good for digestion and acid reflux as well. A lot of people take aloe, and that's the same aloe like aloe vera from the plant. So then those are really for acid reflux, and these others can help in other ways. So betaine actually increases stomach acid. So I just put it in here as an extra supplement just to mention. I have some patients that don't make enough acid. They get what we call hypochlorhydria, and they have really a lot of trouble digesting food, and sometimes proteins in particular. So if you have a lot of trouble digesting meat, you might actually not have enough acid in your stomach to help start breaking those down. And you can take some betaine with it, or when you eat. Now you want to take it first, it increases acid, so you don't want to take it after you eat and have all that acid sit right on top of the food going back up the esophagus. You want to take that first, then eat, and it can help. So if you know somebody that has a lot of trouble, seems like digesting protein and meat when they eat, they might try some betaine. It's an over-the-counter supplement. And then pepsin is a digestive enzyme that helps us break down proteins. And then probiotics, they're always good. Probiotics help restore normal bacteria, and the commercial products typically make it to the stomach and into the small intestine where they help. So if things below the stomach work better, there's less pressure of things to go the wrong direction. Right? So, and then if it gets real bad, you can have surgery. This is a pretty intense surgery. It's called a Nissen fundoplication. You take the fundus, the upper part of the stomach, and you wrap it around the esophagus and tie it, and it makes a stronger squeeze at the bottom of the esophagus. So, but as you can imagine, that's a pretty significant surgery. So, you want that? That's pretty much it for acid reflux. It's a very common thing.